Hi, my name is Dr. Jason Hurbanek. I'm an orthopedic surgeon with a specialty in sports medicine here at Illinois Bone and Joint Institute down in our Joliet and New Lenox locations. So the taper period is a really important part of training. Ideally, after all the wear and tear in the training season and the long runs, this is a time for your body to really sort of store up the energy and get ready for race day. Injuries pop up and runners will feel aches and pains. Aches and pains are common and ideally will resolve or respond to treatment, adequate treatment, things like relative rest, ice, anti-inflammatories, stretches, foam rolling, tissue massage, etc. If those injuries or that pain is not going away with those treatments, then that would be time to seek treatment or seek a consultation with a sports medicine provider. I would not recommend trying to make up the mileage during the taper period. I feel like it's too close to the race day, and if you're going to try and squeeze in a couple of really long runs prior to the race day, your body may not have time to recover in time for race day. So if you happen to miss a run or two, which is very common, especially with people's busy schedules, I would just stick with the original program that you had set out to accomplish and make sure that your body's rested and ready for race day. The treatments that we typically recommend for mild injuries would be, again, relative rest or cross training. Maybe take a little break from some of the intense running. Look to things like cycling or lifting, yoga classes, stretching, those types of things. Also, good flexibility training, sometimes tissue massage. And so there's a lot of common over-the-counter anti-inflammatory medications, including Advil, Motrin, or ibuprofen. Also, Aleve. Those can be helpful to eliminate some of the inflammation that's present that might be contributing to some of the injuries or the pain that you're feeling. And you want to try and get that out of your body or kind of calm that inflammation prior to race day. You certainly can consider using a brace. There's no great evidence to say a brace is going to make a difference or not, but if it helps and you feel better in it, by all means, it's a reasonable option. I would just simply caution you as to adding something right before the race, maybe something you haven't trained in or haven't used extensively leading up to the race, because the last thing you want to do is change something on race day or right before the race, and your body's not used to that, and then that contributes to something else during the race, like blistering or cramping or something like that. So during the last few weeks, to avoid injury and get to the start line, I would say stick with your program. Have confidence in the program that you started back in May or June and stick to that program. I wouldn't deviate too far from it. I wouldn't change too much. And if you are having some aches and pains, just consider some cross training, some cycling, some weightlifting, some yoga classes, something to keep your body going, but maybe take a little bit of a break from the running so that you're ready for that race day. So my top bit of advice would be to just trust your training. In my experience in running marathons, I've been fortunate to be able to run 3 marathons, 2 of which were in Chicago. It is an amazing, fantastic event. I get chills just talking about it. Trust your training, trust the process, and enjoy the race day. Feed off the energy from the crowd and the audience and the noise. It's really an amazing day to see everybody come out and support you. And ultimately, if you trust that, stick with the nutrition, stick with your plan, make sure that you're getting the nutrition and the hydration at the stations. Stick with that, and I think things will go well.